Hi, I'm here with Jenny May at the 6th Rural and Remote Health Scientific Symposium in Canberra. And after the session this morning, Jenny chaired what was really an interesting and stimulating session with 3 speakers. And I'm just going to ask her to recap on some of the main messages coming out of this morning, and in particular to pick up on comments made by Paul Worley, the Rural Health Commissioner, who said it was important both to recognise what we've done well, but also what we haven't done so well in rural health, and to acknowledge where we could do better. So I'll ask Jenny first if she could identify perhaps 2 or 3 areas in which she thinks we have done well in the area of rural health. Jenny.
So I think what we have done over time is actually identified and owned some of the interdisciplinary and multidisciplinary approaches. So team-based care, which has been in many ways the norm in rural Australia, I think is better recognised now for that. So the discussion about generalism, now obviously rural generalism in terms of Paul Worley's job initially as the Rural Health Commissioner, but allied health generalism and nursing generalism, and that discussion about valuing a wider scope of practice, I think is very much on the agenda. And I think that has been testament to rural clinicians and rural research actually identifying that a wide scope of practice is actually very helpful in terms of achieving good community health outcomes.
Yep. And does that go against perhaps trends in urban healthcare?
Well, it's in spite of. It's absolutely in spite of, because we are in a world where we train more specialists than generalists in terms of medicine, and I don't think it's any different in terms of nursing and allied health training. So we train predominantly in tertiary centres, and we train and equip people with the skills and the expectations for that type of work.
Yep.
So I think skills that makes people both better able to manage, so competent, but also confident in a rural setting. And I think that professional level of professional factors is the one where we can make the most difference.
Yeah, okay, that sounds good. And what would be, you'd say, the main area in which you think we could do better and we should be looking towards the future?
Well, there remains enormous variability in the quality and accessibility of our health services in rural and remote Australia. So we talked this morning about how we focus on the commonalities as opposed to the specifics. Paul mentioned that if you've seen one rural town, you've seen one rural town, and we all know that. I guess what that says to me is that there is still enormous variability in what our rural citizens can expect in terms of their primary health care service. So given the fact that 10 years on with extensive, or 20 years on in terms of rural training occurring in rural areas and a real focus on rural health, we still are not delivering that consistent level of quality, accessible primary care. And for that, I'm sorry.
Yes, okay, that's a really good point. And if there was one message that the Minister for Health and the government more generally could get out of this morning's session, what would you like them to have heard from this morning?
What I would have liked them to hear is that in order for rural health services to do well, there needs to be an absolute focus on rural health services. So what we heard this morning was there are major differences in the way that both communities and health services function, and we still have a huge gap both in health outcomes but also in risk factors around health. So we are dealing with a different population. So we need support in terms of both training, research and health services that actually understand that difference. Now, for me, that doesn't mean we need a whole lot of rural-specific funding. We need mainstream funding that acknowledges different ways of operating and allows us to build careers for rural health clinicians and researchers so that we have a resident population in the areas where we need it. Now, we're partly on the way to that. We have a significant amount of undergraduate rural training occurring in the bush, and that is to be celebrated, and that is the difference. And the audience today is half old fogies like me over the age of 50, but there are a significant number of young people in the audience. Now, that is what I would tell you is how I'm going to measure success. But my job is to create a critical mass of clinicians and researchers in non-metropolitan areas that can carry that on and do that job. And it's only by that work occurring that we will have the information and be able to change what in some cases remain really poor health outcomes, of which I'm embarrassed.
Yeah. Okay. Yes, some of the statistics this morning were really shocking.
Galling.
Yeah.
You know, we sit in a first world country with third world health outcomes.
Yes.
I think the other message that I'm really hoping the politicians hear is that foundational primary health care, and I'm not advocating that as a doctor, I'm advocating that as someone who lives in a rural community, is so important.
Yeah.
So specialist services are very valuable and an important part of the pie,
Yes.
but unless we have foundational, available, accessible primary health care, the value add of specialist services cannot be had. And I think in this time of using technology and remote access and telehealth, we absolutely need to nuance that message to government.
Yes, okay, well that's a really good message for Minister Greg Hunt to hear, given his focus on primary health care and the Primary Healthcare Networks initiative. So let's hope he's listening. Thank you, Jenny May.
No worries.